Okay, so here we're going to go ahead and read that last question again. This patient is most likely has been taking which of the following drugs? So which drug? We're looking for a drug here. So now we're going to go ahead and read through the question. An 18-year-old woman, age is always important, comes to the physician because of nausea, vomiting, and abdominal pain 1 hour after ingesting a glass of wine with dinner. So we have nausea, vomiting, and abdominal pain. 3 days ago, she began antibiotic treatment. Her vaginitis after a wet mount preparation of vaginal discharge showed a modal protozoan. This patient most likely has been taking which of the following drugs? Okay, so here again, I think that there's several ways that the question can go. You can first figure out what the diagnosis was here, and then figure out what is used to treat that. And you can say what medication causes these side effects. I would say the three most important things for pharm are knowing which disease the drug causes or diseases, its mechanism of action, and side effects. So here we can go disease and side effects. We can go two different routes for this question. Okay, so first I'm going to look at the diagnosis. So I know it's an 18-year-old woman, so a young adult, and she began taking an antibiotic. So we know it's an antibiotic for vaginitis. And we know that the diagnosis was made based on a wet mount that showed a motile protozoan. So the main causes of vaginitis are Candida, bacterial vaginosis, and trichomoniasis. So Candida would show hyphae, kind of that yeasty branching hyphae. BV would show clue cells. That does not say here. And Trich would show a modal protozoan. So I know that the diagnosis is Trich. And we can go the other route by looking at the side effects. So if you look at ceftriaxone, chloroquine, clindamycin, or metronidazole, well, first we know, one second, about that. So we can look at these options of medications, and I can go ahead and already mark out chloroquine because I know that that's more likely to treat malaria, and I don't think that is what's going on with our patient here. Now we are down to ceftriaxone, clindamycin, and metronidazole. So I know that metronidazole is the treatment for trich, but if you didn't know that, and you could look at the side effects here, nausea, vomiting, abdominal pain. The main side effect that we see with ceftriaxone and most cephalosporins is if someone has a penicillin allergy, you can see an allergic-like reaction. And this seems pretty severe for an allergic-like reaction, and it's not anaphylaxis. So I'm going to go ahead and mark that out. Clindamycin and metronidazole can both treat anaerobic infections, so that can be a little confusing here. But it's important to know that metronidazole can cause something called a disulfiram. I don't know if I spelled that right, but I think I did. Like reaction, which means that after ingestion of alcohol, such as this patient had a glass of wine with dinner, it can cause things like nausea, vomiting, abdominal pain, things that you might associate with a hangover. So again, we can connect this circle, knowing that metronidazole is what is used to treat trich, and that it can cause these disulfiram-like reactions after ingestion of alcohol. All right, thank you. I hope that was helpful.